Good night from Istanbul. Once more again, I'm gonna show you another COVID patient whom I diagnosed a while ago. This time it will not be from the hospital, but I just got back to my home and uh, after drowning in the traffic jam of Istanbul, I could just get back to my home at last. And one of my patients from the clinic now from the hospital this time just sent me her ID card numbers to make me be able to get into her to her thorax tomography records uploaded to internet. I just entered her ID card numbers besides password and it could be able to enter to her password protected place whatsoever. Let's go on. A 20 years old female patient, as I told you. This is my personal computer. I just want this video to be under record, and I just want you to this date to be under record as well. Just as it says 11:40 p.m. Friday, September 25. Okay. Yeah. Let's go. I'm gonna start from the upper regions of the lungs. As maybe you watched my previous video that I uploaded almost a month ago. That's the main trachea, main breathing way, located at the frontal side of our neck. And I'm going downwards, the right shoulder, the left shoulder. And here we are beginning to see the right apical region. I mean the right top region of the right lung and the left lung here. And as we are going on downwards, the mammal tissue here, and air is short here. The trachea is going on broadening the right lung here. There are several small vessels spread all over the lungs, both sides at the same time. The air that can be seen just as, because this is the lung window, it's been called as lung window when evaluating a tomography. This this tone is being called as lung tone. The tone shows because this shines, the remaining parts of the body shines a lot more than when compared with the lungs themselves. Because we gotta see all the lung tissues in details, the remaining parts shine too much, so we are not able to evaluate the remaining parts of the body in these sections. I'm gonna go on going downwards. There are so many bronchi and vessels. They are prominent because there is an ongoing bronchitis. By the way, I gotta explain this patient to you. 20-year-old girl, a female patient, almost 8 days ago, she just felt back pain and a fever that cannot be taken under control by the regular painkillers and the other fever controlling drugs. After that, she just decided to go to the nearest hospital, and a chest tomography, thoracal tomography, had been taken, besides nasal swab PCR test had been made to her and declared her that the test result would be declared to her in the following 2 days. It's such a normal thing because there are thousands of people are being taken, so many tests. And by the way, another second way, maybe we can talk that the first wave never ended in Turkey, especially in Istanbul. It just the numbers of the cases just diminished, but it didn't disappear, or it never came to a controllable level. But we can talk this peak as this maybe second peak of the first wave. Maybe we can name this as the second wave as well. That really doesn't matter. The number of the cases increased in Istanbul dramatically, really drastically. Anyways, gotta go downwards. We are going on. The left side is we are just looking from the top of the patient. Just think about that. And she is laying down on the bed, the tomography bed, and we're just looking from her head side towards downwards. And as we go on, we think that we had taken so many slices here, and after taking so many slices, we are looking all the slices apart from themselves in 1 centimeter or something. Okay. Anyways, I'm going on showing the remaining parts. As it can be seen here very easily, the heart tissue, the heart itself is being seen, and I'm going downwards. The main sternum, the main bone in front of the chest, supporting the ribs, right side and left side. We're going on. There are so many bronchi, and the vessels spread all over the lungs because there is an ongoing acute bronchitis. There are so many spherical things, but these are not the lesions, but these are the sections cut through and showing the vessels or the phlegm-filled bronchi. We're going on, going downwards. Here we can see the liver is certain here, the liver tissue, but there's a hidden, very well hidden, small, tiny, knotty lesion here at the front side. This is the front side, this is the back side, and as we go on, we just realize a small, tiny thing here. Spherical. Think that as a small grape and collected that there. Slices here. As I go on downwards, you just see the bottom of the grape, maybe a spherical, tiny, not tiny, but its size is almost 1.5 centimeter diameter. I'm going upwards. Just see this spherical lesion. We call this as ground glass opacity lesions, but the main difference from the remaining viral infections such as influenza, pneumonias, is this ground glass opacities really are really spherical. As you can see, the bottom and the midsection and the upper side here, and it just started to diminish and disappeared here. The the bottom. It can be seen here, and the top section. I'm gonna go on preparing videos, not just about the tomographies and about how to put diagnosis. There are several other videos that I can. The reason why I prepared this video is just because the lesions and the disease can be seen easily even at the age of 20 years old youngsters, rather than the elderlies. I mean, but in the elderly patients, I'm gonna show two different chest tomographies from the same 75 years old lady, and the time period, the time distance between the two tomographies are just 5 days, and you will not believe your eyes when you see the differences between those two videos. Anyways, it will come in days, and there are several other videos that I will prepare for you. But what I'm intending to do is to finish the total mechanism, especially for the hydroxychloroquine and tonic water, which is consistent quinidine and quinine inside of it as the potent chemical substance, and their action or mechanism of action whatsoever, and how they work while treating the disease, especially when the cytokine storm affecting the body so densely and harshly at the very beginning of the disease itself. Anyways, good night from Istanbul, Hospital Dere, Emergency Department, Dr. Osan Koshar, and my regards, and stay safe, keep your distance with the other people, and do as much protective things as you can, just like wearing face masks, especially amongst the people, and when you are in crowded places, I strongly suggest you to use those masks. Other than that, especially in the sunlight, just because the virus, I told you this before at the video that I prepared previously, the outer shell of the protective layer of the virus is totally transparent, and the genetic material of it is completely vulnerable to the UV light, and you do not need to wear face masks under the direct sunlight, just because the genetic material is disrupted suddenly after it's been exposed to the direct sunlight, because of the UV light sunlight will provide to the air. Anyways, please take care. Good night from here.